Hello to everyone attending the Society to Improve Diagnosis in Medicine's Future of Diagnosis Conference. Those are a lot of words, but you know the good work you do. Welcome to Minneapolis. I'd like to thank SIDM CEO, Dr. Jenny Ward Robinson, for inviting me to share just a few words with all of you today. First, I'd like to thank all the incredible healthcare professionals, researchers, policymakers for your commitment to strengthening the quality of diagnostic processes to create better healthcare outcomes. The work you all do is so important because, as you all know, inaccurate or delayed diagnoses are the most common form of medical error. Okay, I didn't know that until I talked to your group, but now I do. It affects approximately 12 million Americans every year, and it imposes significant financial costs on our healthcare system. These inaccuracies can lead to devastating consequences for the patients who have their illnesses incorrectly identified or who never receive a conclusive explanation for the chronic pain or symptoms they're experiencing. Just yesterday, I talked to someone who told me they had gotten a diagnosis. I think it was like rheumatoid arthritis. And she said, I go, oh, are they helping you? She said, yeah, the medication couldn't kick in yet, but just knowing what I have explains everything, and I feel better because I know what my path forward is. When you think about the people that don't get a diagnosis or get the wrong diagnosis, again, devastating. Errors can account for 40 to 80,000 deaths annually, roughly equivalent to the number of people who pass away from breast cancer each year. While this can happen to any patient, patients with rare diseases are especially likely to be affected by late diagnosis. It takes on average nearly 5 years for patients to have their rare diseases accurately ID'd. 5 years of countless visits to different doctors, mounting copays, unnecessary tests, wasted time, and of course, incredible frustration. The real-world implications of these stats are unacceptable, deeply personal to me. As some of you may know, following a routine mammogram in February 2021, I learned that I had stage 1A breast cancer. Thanks to cancer being detected early and my incredible doctors and nurses, my treatment went really well. My doctors believe that my chances of developing cancer again are no greater than the average person's. But I know there are so many patients throughout our country who didn't have their cancer detected in a timely manner, delaying them from getting the treatment and care they need. Even I waited longer than I should have because of the pandemic, and then I kind of started using it as an excuse before going in to get that routine mammogram. And I'm lucky they caught it in time. But after I made the announcement that I had had the cancer, I couldn't believe the number of notes I got. People actually were writing me while they were in the waiting room waiting to get their mammograms because they realized they'd put it out. It's one of the reasons I'm leading bipartisan legislation called the Cancer Patient Equity Act that would improve access to diagnostic services by requiring Medicare and Medicaid to cover the costs of more accurate testing services for patients enrolled in these programs. Our bill would also devote resources to ensuring that health providers are utilizing the most effective testing available. Increasing access to quality diagnostic services is one piece of the puzzle, and another piece is investing in improving the accuracy of the services. My state of Minnesota, a place where I'll say all the women are strong, all the men are good looking, and all the healthcare professionals are above average. My state has long been at the forefront of this, with Mayo and the University of Minnesota collaborating with the Centers for Disease Control and Prevention and advancing diagnostic technology and education. Their leadership is so essential because the investments we make today will pave the way for less frustrating, life-saving detection. To that end, I've long pushed to put federal dollars into expanding and upgrading these programs, and I'm proud to announce that this year we're on track to secure $50 million in the federal budget next year to support the CDC's Advanced Molecular Diagnostics Program, the largest increase in base funding that the program has ever received. I'm going to continue pushing for more resources in the years to come so we can keep helping patients and preventing and responding effectively to infectious diseases. Thank you again for your dedication to improving our diagnostic systems so we can eliminate medical errors and better protect our patients. I'm proud to be your partner in Washington, fighting for high-quality health care that saves lives. Keep up the great work. Enjoy the rest of the conference. You deserve it.